I received few messages in the group. Uh, this case I posted in the group, and I received few messages after that. So they wanted to understand the process, the procedure. So I thought of recording the entire procedure and explain you the steps. What are the steps for to do this biacuplasty procedure? So just to brief you about the case. So I already discussed in the group that this is a case of discogenic pain, typical discogenic pain. A young guy, 35 years old. He cannot sit for more than 10 minutes maximum. That is what he can sit. After that, he start getting pain, and it is, you can see it is very clearly evident from here. There is a big tear over here in the disc, and you can see the degeneration of the disc. Uh, Look at this atrial section also. You can see there's a big tear over here. Also, there's a tear over here and one small tear over here. So these are the three discs which are involved. But clinically, you can either you can go for the provocative discography for all the three discs, and you can find out the most painful disc, or the other method, the non-invasive method, is that you see the tenderness. So he was having tenderness over the spinal plexus of the 3-4. So that is why we selected for the 3-4, and you can see from the axial section also, this is uh, the most uh, painful area, and we can't see on the MRI the painful area, but what we can see is the biggest tear in the L3 L4. So that is why I selected this L3 L4, and uh, the technique is basically we identify the L3 L4, we paralyze the end plates because we have to enter the disc which is between L3 and L4, so we have to paralyze the end plates, the lower end plate and the upper end plate, and then we start going when we start going oblique. When we start going oblique, then you can see from here that this much oblique is required. Uh, we may start from the slightly more lateral because here we have to target the posterior annulus. You have to go more oblique in this case. If you have to go into the center of the disc, in that case, this position is correct. We can go in this end on view. But here I start from the slightly lateral side and go towards more medially so that I can reach the posterior part of the annulus. So this is what we do from the left side. I'm starting from the slightly lateral part of the SAP, go towards midline. This is the 22 gauge needle with which we inject a local anesthesia up to the annulus, and then we come out infiltrating the entire track of the from where we have to go with the RF probe. So this is the left side, then the right side. Similarly, the right side, I'm starting from the slightly lateral part of the SAP and going towards the medially. So this maneuver will help you in reaching the posterior part of the annulus. You don't want to target the center of the disc in this case. So after infiltrating, now you can see this is the RF probe through which we are going. The same technique we are using, what we did for the local infiltration. Going radially, you can see here. I'm going, it's not going on end on. Going slightly radially. Other side also you can see here. Now on the other side, that is the right side. So this is the target. What we want to intend is that we had to cross the medial pedicular line. That is important here. We had to cross the medial pedicular line on both the sides. I'll show in the lateral that we have crossed the medial pedicular line, but we are still in the posterior. Now look at this. Look at this. We are still in the posterior. The tear is somewhere here. When we inject contrast, we'll see that tear also. So we are not trying to reach the center of the disc. That is not required in this case because here our target is the posterior annulus, that is annuloplasty. Our target is not a disc denervation. In case of disc denervation, we may go slightly more anterior and we can target the entire disc. Again, depending on the pathologies to pathologies. So this we must understand. So right now I'm just targeting the posterior annulus. I'm keeping it there only. So I get the contrast. So you can see the uh, contrast moving. You can see here. This is the first probe. The contrast is inside. You can see the tear in the posterior annulus. That's a tear over here. That's a big tear over here. Contrast is leaking through the tear. This is the high intensity zone, what we saw in the on the MRI. Now we remove the second one and then we inject contrast. We inject more contrast and you can see the proper distribution. But this is not a in the later view we cannot make out that whether it is in the nucleus or we are still in the annulus. So now we look at this AP view. In the AP view, we can see that it is covering the both the sides. So that means we have crossed the annulus and we have reached the nucleus pulposus from both the sides. After doing that, then you can see here, this is the probe we have inserted through that cannula. You can see this is a marking over here, and you can see the distance between these two. So that is the ideal location. We have to keep a distance, like we have to cross the entire medial particular line, reach over here to the center over here. In the lateral view, it should be in the posterior part of the neck. So this is how we do. You can see here both the markings over here, and these are the markings which shows that. So while coming out after doing the after listening for 15 minutes, 50 degrees centigrade, usually for the annuloplasty, when we want to keep it in the posterior part of the annulus, keep it around 50 degree only. Don't go beyond that, because otherwise the heat will leak out from the annular tear, and that you have a nerve roots over here, dura over here. So that we don't want to damage. So that's why we keep it around 50 degree. If we want to denerve the entire disc, in that case, we can go slightly more anterior, and then we can go up to 55 degrees centigrade. So while coming out, I just inject contrast over here. You can see this contrast is coming to the middle space. And now you can see this is the exiting route over here on both the sides. This is the exiting routes, and the traversing routes are here. So we are exactly in the Cambian's triangle. So this is the Cambian's triangle, what we normally see, that Cambian's triangle. So this is exiting route on both the sides, and we're in the Cambian's triangle. When we come out, and then we just inject some dipomodal over here around the disc in the middle space, and this is how the process is complete. I think now you understood the entire procedure. We'll keep sharing. I think this is the best way to share the videos. We'll keep doing that. Thank you.